ಒಂದಷ್ಟು surprising statistics ಇಂದ I want to begin my today's episode. India roughly delivers 26 million babies annually. That's quite a huge percentage. But then, idರಲ್ಲಿ almost 5 to 10 million children require pediatric care every year. But you know what? Practice ಮಾಡ್ತಿರುವಂಥ ಪೀಡಿಯಾಟ್ರಿಷಿಯನ್ಸ್ಗಳ ನಂಬರ್ ಅಂತ ತಗೊಂಡಾಗ ದ ನಂಬರ್ ಇಸ್ ವೆರಿ ವೆರಿ ಲೋ. ಒಂದು ಆವ್ರೇಜ್ ಅಂತ ತಗೊಂಡ್ರೆ ಇಟ್ ಇಸ್ 50,000, ವಿಚ್ ಡಸಂಟ್ ಮ್ಯಾಚ್ ದ ರಿಕ್ವೈರ್ಡ್ ರೇಷಿಯೋ. So it is the most under-addressed public health issue in the country. So today on the show, I have a very, very special pediatric surgeon. So she is a lead and senior consultant for pediatric surgery at Astor Hospitals, and she comes with an experience of 25 years in advanced and complex pediatric surgeries. Dr. Manjiri Somashekhar has performed over 15,000 complex surgeries. So who better than Dr. Manjiri Somashekhar to talk to us? Hello, Doctor. Namaste. Welcome to the podcast.
Thank you so much, Saujanya. It's my pleasure to be here amongst you all today.
Thank you, ma'am. Likewise. So, as I told in my opening, there is a huge gap between the requirement and what exactly is available in our country today. So, I think for the current population, an estimate is 115,000 practicing pediatricians. That is what is required. But on an average, I think approximately we have 50,000 pediatricians. How do we fill in this gap according to you?
Yes, I would like to make a small correction here, Saujanya. We are talking not about the pediatric surgeons here, pediatricians here.
Yes.
It's about the pediatric surgeons. So if you feel that the pediatricians themselves are not enough for the huge population of the children who require a tender care, then can you imagine 10 to 15% of this population requires surgical care. And today in India, we have roughly about 3 to 4,000 pediatric surgeons. That's all we have. So if you're talking about 50,000 pediatricians are not enough to cater our population in children, then look at the numbers at pediatric surgeons. That is still less. Correct. But having said that, again, the number of children who need the surgical care for treating any kind of surgical illnesses is not that much. But it definitely makes a huge difference in the infant mortality rate if they are addressed properly on time by a correct surgeon who is trained to handle children and the neonates.
And surprisingly enough, as you mentioned, pediatric surgeons kala number, it's just 4,000 to 5,000 anta. But in the 1940s, for the entire country, India had just 12 to 15 pediatricians. And cut to 2025, we just have 4,000 to 5,000, which is still very, very less. What would be an average figure that you would expect?
Yeah, I would like to tell that the number of pediatric surgeons which we are expecting is at least 50,000.
Pediatric surgeons?
Yes,
Okay,
for the
okay.
existing population. More than that, there is a lack of awareness. The existing surgeons themselves, they are not able to cater to the population because somewhere there is a mislink where the people are not knowing whom to address for a particular problem in a child. So because of that, this year we are celebrating 29th December as a Pediatric Surgery Awareness Day, wherein we are trying to reach out to the population, literate, illiterate, doctors, non-doctors, children, adults. Everybody should know about what is pediatric surgery about. And we want to reach every child who can be delivered with a safe surgery at safe center for the better outcomes and a better future of the country, of course.
And that is the theme also.
Yes.
Of this year.
Yes.
Talking about pediatric surgery, I think it's extremely complex as well because according to our understanding, doctor, what is a pediatric surgeon? What does he or she do? Surgical treatment for infants or children is what we believe, but this also includes teens, which not many people know. So can you help us understand what is the difference between performing on a infant, children or teen versus the adult surgeries?
Yes, of course, there is a huge difference, Saujanya. And we are not like any other surgeons which are adult surgeons. After our training in the adult surgery, just to get a sync of the entire surgical procedures, we are trained again for the next 3 years to deal with only children. And children means it starts from right birth, to be precise, before birth till the age of 18 years, which is a definitive age which is declared by Indian Association as well as the American Association of Pediatrics. That is the age till when we consider an individual as a child. So in that also we divide age-wise a newborn, which is till the age of 1 month, then is the infancy under the age of 1 year, then it is under 5 years, then these are the toddlers, then it comes children till the age of 10 to 12 years, then the adolescents and teens. So this is how the entire childhood is divided, and every age group will have certain definitive procedures which are specific to that age group. So, if we talk about the neonates, which are so tender that they will be born with certain birth defects, which are there due to the developmental anomalies. And nowadays, since the ultrasound is compulsory before birth, we can detect them before birth. And there are certain procedures which we can do before birth to prevent the harmful effect of those anomalies, and after birth the definitive treatment can be done. So advances in medicine has brought us to a point where we can detect these anomalies before birth also, and timely intervention can happen. Now the question is, though India has advanced so much in technology and medicine wise, we are still lacking in communication. So we need to reach each and every individual who needs this kind of treatment to treat their child, and we need to spread a word that what is pediatric surgery about, and they should reach out to a pediatric surgeon for a specific problem.
Correct. And also, I believe, doctor, it's very difficult and different while performing on infants, children, and teens because their organs are still developing and they have to still adapt. So, the way they receive antibiotics or anesthesia, I think that will be different when compared to adults, right?
Of course, yes. You said it very rightly. Just as the surgeons are trained to treat these children, similarly, our counterpart, that is the anesthetist, they are equally responsible for the better outcome of the surgical procedure. So these anesthesiologists are also trained in pediatric anesthesia, wherein they deal with access of the small veins in the children, intubation of the child, perfect dosage to be delivered to give correct anesthesia, not only in anesthesia but get the child out of anesthesia. Breathing should be smooth, and also there is a big team who helps us in the perioperative period, like the neonatologist, the pediatrician, the intensivist, the pediatric nursing care. Even that a normal individual nurse cannot take care of a child. She has to be trained to handle the children.
Correct.
Because if you know, in a hostile environment the child is going to be very very anxious, he'll be continuously crying. So one should be trained to tolerate, and one has to be very patient and calm, and we need to understand the unspoken language of these ailing children. So that is very very important. So it comes with experience.
Yeah.
During the training period we do learn the procedures what are to be done, but only with the experience we know how to understand them, how to treat them, how to deal with them, and make the entire process as less painful as possible.
I think you summed it up really beautifully. We'll have to understand the unspoken language. So, everybody
Yes.
who's treating a child should be a mother because only a mother can understand the unspoken language of a child. And also, you
Yes,
should
a
have a
heart of
trained
mother
eye.
is required
Correct.
here. You don't have to be the mother, but a heart
Correct.
of mother is appreciated to understand what the child is going through.
Yeah. And also to have a trained eye is so important. So, that leads us to neonatal surgeries. Usually whatever small things happen to kids, it might be small, but we parents, we panic and we call the pediatrician immediately. So usually going to a pediatrician is okay, but if they suggest us to go to a pediatric surgeon, that will scare us further because then we'll start to think, okay, ಇವಾಗೇನೋ ಒಂದು ಸರ್ಜರಿ ಮಾಡೋದಕ್ಕೆ ಹೇಳ್ಬಿಡ್ತಾರೆ, my child will be operated, what next, what might happen, is it something serious, big? So what are the most common emergencies that you witness in today's day and age?
As far as they are going to the pediatrician just for injection, just for some medicine, they're okay with that, and they don't mind going for every drop of a hat, going and addressing to the pediatrician and knocking at the door in the middle of the night. But if at all by mistake the pediatrician asks them to consult a pediatric surgeon, then most of the parents, they take a back step, they go back home, they think for a while, and they think that it is something which is more dangerous than, but then they don't understand that if they don't reach in time, then it is going to be more harmful. So here the important role of counseling is very very important. And that is the reason I keep saying why it is important for people to know that there is something called a pediatric surgeon. For example, I'll tell you, in emergencies, very young kids, the toddlers, where they are playing with the small toys, there are dismantleable screws and small parts of the toys, and they immediately, as per the habit, they immediately put it in their mouth. So it can go into the stomach, it can go into the breathing passages, and the child can have difficulty in breathing suddenly. So if it's identified on time, they need to rush, and there is something called as golden hour.
Okay.
So if treatment is done in that time, then we can save lot of complications. I won't say that we can't save the child or something like that, but then there is some time period before the complications set in. If the treatment is finished, then we can save the further problems in that child.
So you're saying it is still the most common problem that you see, that a child
Yes.
swallowing a foreign object?
Yes.
Okay.
And the other thing is, children, they are naughty, so they fall here and there and they get cuts, marks, burns, a lot of things. Those also, if they are treated in time, somebody needs stitching, somebody needs a cleaning of the burnt part and the proper dressing, so that the healing happens properly without any kind of infection. So those are subtle things, but then if the parents understand the time period during which they have to immediately reach out to the pediatric surgeon and give the treatment properly, then I think a lot of problems can be saved.
Doctor, a couple of decades ago, a lot of deliveries used to happen at home, very safely also. But of course, we used to see a lot of deaths happening of the mother and child also. But now that's reduced, all thanks to the present technology and the hospitals that we have, the accessibility that we've got. Today, most of the deliveries, 99.99% of the deliveries happen in the hospital. So not just that, after that, we are always regular with the follow-ups because it's about our kids. So parents, we are concerned and we are always regular with the follow-ups and checkups, all the injections, it's all up to date. So do you think in today's day and age, surgical issues are detected much earlier? Because anyway, we're taking the child to the checkups regularly.
Yes, I agree, Saujanya. Not only that, the pediatricians are also making the parents aware of this. And to be frank, because of the hospital deliveries, the infant mortality, which was as high as 50 per thousand few decades ago, now we have reached to an average of 25 per thousand births in India. So this is the recent census of 24-25 year. And I'm proud to say that most of the mortality, which was because of the surgical causes, which was correctable, they are identified as early as I said before, also before birth. And we have lot of obstetricians or the radiologists who are taking keen interest in detecting this by ultrasonic diagnosis, and then they address it. So counseling is done at that level itself. And sometimes there are multiple defects also which can be detected as early as 14 weeks, 16 weeks. That is much safer to counsel the parents. And if it's multiple defects, there is no point in continuing the delivery, pregnancy as well. So we help these investigations, they also help the parents to take the decision about continuing the pregnancy or not.
And doctor, as we discussed before, ನಮಗೇನಾದ್ರೂ ಅಂದ್ರೆ okay. When it's about our kids, we're always scared a little more than what it should actually be. Also, even after a pediatrician or a pediatric surgeon says, no, this is nothing serious, I'm sure parents will have a lot of questions. And even before we started this shoot, you were telling me that you will hand over your personal contact number for such parents, which is really amazing. Because in today, in a place like Bengaluru, I don't see many doctors giving away their personal numbers, because you would have a personal life too. So we'll have to reach them via maybe your assistants or somebody who's at the hospital, who's at the reception, or we'll have to reach out to the clinic. You're doing an amazing job. Hats off to you. And let me know, as a doctor, how would you handle such situation when parents are really panicked about their child?
Rightly said, Saujanya. Most of the pediatric surgeons behave like me only, because we not only treat the child, we are so involved into the child that we have to treat the entire family. Starting with the counseling of the parents, that is a very big task, because the child itself doesn't understand anything. It just needs to be get rid of his pain, whatever is there. So, going through the entire journey, counseling the parents, we do multiple counseling, sometimes drawing figures, sometimes giving examples, sometimes showing videos. I even give them the links of the websites where they can gain some more knowledge if I am short of time. And I would also address to their every question. Sometimes they are so anxious that in my OPD room, they are not able to come up with the questions and they want some more time. So that is a case where I tell them that this is the website, you go read about it, write down your questions, you can send me as a WhatsApp or you can call me. and we can meet another day to address these things if it's not a rush or emergency. So it's very important for me to gain the confidence of the parents that today you are giving your newborn or a small child in my hands, and I'm going to deal with it. I'm going to deal with the unconscious child and come back with good results. So it's very important for me that I have full confidence of the mother. Today, a mother giving her child away to somebody else, and then she expects the child to come back in her lap with smiling, and which is got rid of its pain as well. So it's very important for us to be in touch with the parents, gain their confidence. Not only parents, many a times even the grandparents are also very anxious about it. And I have seen that the young parents, they don't want the grandparents to interfere much, they just want to be there in support. So I understand this emotion, and many a times I, as grandparents, I think you need to talk to me. Do you have any concerns? Are there any practices you would like them to follow, or you would like me to follow, something like that? So I see that they are so happy that there is someone who is addressing, and we are noticing their anxiety as well, because gone are the days where the parents used to think that once we are in the doctor's doorstep, everything is going to be fine. And now they come with a lot of concerns. And the parents who are seeing the doctors in a mega cities, they have a lot of options. That they definitely want to go for a second opinion, third opinion, till they get the answer of your choice. Or if they get same answer or same treatment at every doctor, then they have to decide which one is close to them and which one is more comfortable for them to go ahead and hand over their child for the treatment.
I love this thing that you're following, that you're not just talking to the parents, but you're also talking to the grandparents.
It's very important.
To get their views must be something different altogether. You would have a different experience altogether, right, ma'am? Can you give us an example of what kind of questions parents come up with, and what do grandparents talk about the same case?
I would not like to disclose, but yes, recently, today only, I operated on a small baby who was 8 months old. The parents were extremely anxious, and this was their third visit. So I explained them everything, and we fixed the date, everything. I could see that the grandmother was not happy at all. She had come to help the parents to take care of the child in the post-operative period, but she was hesitant because she was not opening up. She thought that if she asked, it will look like something stupid. So I just held her hand and I said, "Amma ನೀವು ಏನಾದ್ರು ಕೇಳಬೇಕಾ?" So she was, I could see her face enlightened. So she said that, "ನೀವು ಕನ್ನಡ ಮಾತಾಡ್ತೀರಾ?" I said, "Yes, of course, whatever language you want, you can be very open with me and you can ask me any questions." So she had some questions, how long the child has to be nil mouth, and when we can be feed, and will there be any pain, and how will you take care of all those things. And I patiently answered everything in whatever language she could understand, and they were really relieved. Because I think if the grandparents are going to support the young parents in taking care of the child, uh, I don't want them to add to their anxiety. So the young parents are already anxious about the entire episode, and when the grandparents come along with their experience, they also need to understand what the child is going through and what is the entire procedure about. So if we are able to explain them, then as a family, they actually, I have to be selfish here, because I need their help in keeping the child calm at the end of the day because they should not be crying along with the child. So it's a selfish interest little bit.
And especially when you do this with the grandparents, in the post-surgical care,
Yes,
in that tough times also, they'll be of huge help because their experience is such.
definitely yes, definitely yes.
Okay. And then talking about technology. Today, we have so much of technology. I mean, generally talking about surgeries, not just pediatric surgery. So there are minimally invasive surgeries, there are robotic surgeries, there is AI to support, there is SILS. So we know that these are available for general surgeries. And the best part is that in today's day and age, these all facilities and much more are available for pediatric surgeries as well. Do you want to talk about few of the technology advancements which is helping you with the surgeries now?
Yes, of course, I agree completely. And as you rightly said, that minimal invasive surgery, minimal invasive procedures are practiced today in as early as newborn period. Even I got trained in all of those, and I'm also practicing today. There is a safe limit, safe margin which a child can tolerate the minimal invasive surgery. There are certain emergencies where we don't have time to go through the minimal invasive surgery. There we advise for the open surgeries as well. But yes, we do a lot of thoracoscopy, laparoscopy in a small child to get the benefit of all the minimal invasive surgeries. The size of instruments is small. We need to be a little bit extra careful with the pressures which are used in the surgery, because we use certain gas to increase the size of the cavity of abdominal cavity or thoracic cavity, and certain adjustments, or there is certain threshold limits which we have to be careful about. If one is comfortable with that, and with training and practice we do get it, we just need to see that the entire procedure is done safely, and because of the procedure we don't want any complications. So now it can be done very safely. Even robotic surgeries we are doing very regularly for the complex surgeries of the liver, for the intestines, for the tumors, for kidney. We are doing regularly now in our practice.
And talking about pediatrics, there are a lot of subspecialties like neonatal surgeries, pediatric oncology, pediatric urology, pediatric orthopedics, pediatric neurosurgery, pediatric cardiothoracic surgery. As you mentioned, every single thing almost is available. But I believe, ma'am, while operating on infants, children, and teens, the difficulty level is usually high when it's compared to operating on adults. But I believe operating on an infant is like very daunting for you also. Am I
Yes.
right?
Yes.
When compared to operating on children and teens also?
Yes, there are two things in this, Saujanya. As I said, one is anesthesia part of it. The anesthesiologist is the partner in the surgery. You cannot say that they are just giving anesthesia. No, they are the partner. Secondly, in a child, the blood volume or the fluid volume is so less that in a small baby, 10 ml blood loss is also huge loss. So we
Okay.
have to be very, very careful. Firstly, we try to see that we do not lose a single red blood cell on table. If at all we are losing, it has to be under control. The anesthesiologist has to immediately identify and arrange for the replacement of that blood. And there are certain procedures where we expect the blood loss, so blood is already ready before we start the surgery. And certain cases we keep it ready in the blood bank, and as and when required, the anesthesiologist, without disturbing much to the operating surgeon, they just organize, arrange it, and do it. So that's how it is ultimately a teamwork. The nursing staff who is assisting the surgeon, the first assistant of the surgeon, the anesthesiologist, the assistant anesthesiologist, even the technician who is there in the OR room, they have to do their job perfectly. The main important part in the newborn surgeries is maintaining the OT temperature, because these infants, they cannot tolerate cold temperature, and the entire body or the entire system in these children, it slows down and they cannot tolerate it. The heart can slow down, the breathing can slow down. So optimum temperature has to be maintained. So there is a team who takes care of that as well. So the entire outcome is the best work of the teamwork.
Dr. Pediatrics, there are subspecialties, as we know: neonatal surgeries, pediatric oncology, pediatric urology, pediatric orthopedics, and pediatric neurosurgery, pediatric cardiothoracic surgery. But when it comes to performing a surgery on a newborn, it sounds daunting for us. I'm very sure it is daunting and very challenging for you as well as a doctor.
Yes, you said rightly, and the entire surgical procedure is not only the surgery per se, it also involves the perioperative workup, the handling of the baby, handling of the family, as I already mentioned before, and it's a teamwork. Right from the anesthesiologist, the assistant, first assistant surgeon, the assistant anesthesiologist, the nursing staff who is assisting the surgeon, and even the technician who is there in the OR. In small babies, we need to be very particular about maintaining the temperature, optimal temperature in the operating room, because if the operating room is very cold, which is mandatory for the adult surgeries, they maintain the temperature of around 18 to 20 degrees Celsius into the OR. But for us, it's required to be between 24 to 25. We cannot allow the baby to become cold, because the entire metabolism will slow down, the heart can slow down. So it's the entire hard work of the entire team which gives the best results. It's not just the operating surgeon. And as you said, as a pediatric surgeon, we are supposed to undergo the training to handle every organ, and then I can restrict my practice to either cardiothoracic or a neuro or a urology. But As a surgeon as a whole, I will be able to handle any system if it's an emergency on table.
Okay. I think in a infant, even a 10 ml blood loss is considered huge, right, ma'am?
As we already discussed, in the small babies, the blood volume itself is very small and we cannot afford to lose even 10 ml at times. There are certain surgeries where the blood loss is inevitably expected, so we have to be ready with the blood transfusion. Before surgery, it is ready. If not, if the surgeon is in trouble, intraoperatively, the anesthetist will take a call and immediately organize the blood and transfuse it. So that is how the teamwork works. And we have to be firstly very careful that we don't lose a single red blood cell during the surgery. But if at all we lose it, we try to keep it minimal so that the child is able to tolerate that much blood loss. Beyond that, we have to be ready with the transfusion.
And lastly, doctor, without breaching the privacy, can you talk about a case which has stayed with you?
Yeah, there are a lot of stories. Recently, like 3-4 months ago, this baby was born and they found that the baby doesn't have the anal opening. The father was in tears and he said, I cannot tell this to my wife. And I said, you have to tell her because we need to do immediate surgery because otherwise the intestine is going to blow out. And then he said, no, I can't tell her. So I said, I'm sure your wife must be a very brave lady. I need to talk to her. So I just went to her. I congratulated on the birth of the newborn. Then I said, there is a little problem is there with the baby and we need to take the baby for the emergency surgery, but I don't want you to be in the dark. I will tell you everything frankly, but you have to promise me that you will be supporting me because without your support, I cannot go ahead. So it was a kind of emotional gimmick. And to my surprise, without a single tear in her eyes, she sat up in her cot. She was just recovering from a cesarean section. And she said, is that all? I just give you the permission. She signed the consent sheet. And there I came out and I told the husband that you don't think that your wife is weak. She's a very strong mother and she's going to cooperate. So then we went ahead with the surgery. And yes, the next step of the surgery, the baby is ready for that and we are going ahead with that. So there is a lot of role of counseling, as I said, and the parent has to gain confidence in the surgeon who is going to handle their baby. So it's all about communication. And the same communication I want to reach to the people, and they should know when to approach a pediatric surgeon and how safe it is to reach to a pediatric surgeon. It's only I always keep saying that only our patients are pediatric. We are all grown up and we are very responsible people. So we have taken responsibility of not only our children, but others' children as well.
There is a reason why we compare doctors to gods, and especially in your field, ma'am, because as parents, we will be ready to do anything for our children. And when you take this up, not just as a challenge of getting the kid back to normal, you're also counseling the parents, their entire family. This means a lot because caregivers' burden is often ignored, but the highlight is that you're not ignoring that. That itself is the beauty. And ma'am, thank you so much for lightening up so many lives and for sharing your experience with us today. Thank you for this insightful
Thank
session.
you so much. Thank you so much, Saujanya.
Thank you, ma'am.